Good afternoon, ladies and gentlemen, and welcome to this new segment of our new TV program, Medcast. We are glad today to have Dr. Abeer AlAli, who is a pediatric ENT surgery specialist. Welcome, Dr. Abeer.
Thank you so much. Thank you for having
I
me.
think we have got to this place, and it feels like your home. No need
Yes.
to welcome you with a very long introduction.
No need, no need. All is
Alhamdulillah,
good.
Alhamdulillah.
Mhm.
Doctor, let's have a discussion, or a quick discussion today about the speech delay, which concerns the most new families in Kuwait. Probably in the last decade, we have increased numbers of kids or children with a speech delay. So, how can we know that the child is having a delay in speech?
Well, first of all, we need to take it from the very top of the situation, meaning that now in Kuwait is a protocol that we have that is well established very early. I remember maybe even before 2010
Hmm.
that we have what we call the newborn hearing screening test.
Hmm.
So every child that is delivered in Kuwait, before they go home or before they're discharged home, they have to have a hearing assessment.
Hmm.
So actually, we can detect hearing problems as soon as newborns. So if they have an issue, of course, this is a long topic, but again, if there's something, then they have to follow, and then we have to do, all of the investigations to come to the diagnosis and managing the child. When it comes to speech delay, meaning that now the kid, we know that their baby is healthy, everything is okay. They passed their newborn hearing screening test, and now they're at the years of 12 months, 13 months, 14 months, and they're still very limited with their vocabulary
Hmm.
because we know that the kid by 1 year they have to say a word,
Hmm.
and by 2 years they have to say a sentence of two words. So usually, if that is not occurring properly with the kid, that this means that most probably there's a speech delay. The other thing is that we know parents are very vigilant and they could, quickly tell that there's something wrong with their child because they either compare the baby who has a speech delay with their siblings
Yes,
or with their,
relatives.
peers in school or in their cousins and family members.
Yeah.
So I've personally seen that a lot of the families do actually detect speech delay very early.
Hmm.
So once that is the case, then we bring the kid obviously goes to see an ENT specialist, and then the diagnosis is made. Of course, proper history taking. I usually see their previous hearing assessments if there were any that were done before. I definitely ask about the newborn hearing screening assessment. And then we examine the kid's ear. Most commonly that we see in children, a speech delay, especially again, if the newborn hearing screening test was normal
Hmm.
and the baby developed speech delay, then most probably it is middle ear fusion, meaning that there is fluid in the middle ear behind the tympanic
Yeah.
membrane. So if that's the case, then of course the treatment at this point would be surgical.
So you take out that fluid.
We take
That
out
yeah.
those fluid and we put in tympanostomy tubes, which we call ear tubes, that ventilate the middle ears. So all the fluid is drained out. There's good aeration of the air of the middle ear, and then um, usually the speech is improved if that was the only cause of his speech
Okay.
delay.
Yeah, that's the question. Is there like any other causes for the speech delay?
Absolutely,
Yeah.
absolutely. Kids who have global developmental
Mm.
delay, those who have, meaning that they're underdeveloped in terms of their psychomotor and mental capacities. We have also a lot of kids who are syndromic and who, again, it all comes to the, mental and psychomotor developments. Patients who have autism,
Hmm.
and the spectrum of autism is very huge, very large. So those kids also suffer from speech delay. So the issue is not only the anatomy and the aeration of the middle ear, but also they could have issues again with their development that affects their speech
Now,
development.
now we have put our hands on the causes or the
Yes,
main causes, let's say.
yes.
But how can the parents see the symptoms on the children or on their child apart from the number of words, as you said in the beginning?
So if the patient is, let's say the baby is otherwise normal,
Hmm.
meaning that there's no issue besides the middle ear, usually the symptoms are they just can't hear.
Hmm.
So they call the kid and the kid doesn't turn or doesn't respond.
Yeah.
But otherwise they eat normally, they interact somewhat normally. Um, there are kids that are because they can't hear, so they're a little bit more aggressive because they cannot hear, so they cannot communicate properly. that could be also something that they could see in a normal baby.
Hmm.
However, in other issues such as um, autism, there are, of course, it is a criteria of symptoms that we see: communication, repetitive movements, isolation. You know, they are very stuck to their routine. If they change their routine, they cannot, it affects their behavior. So there are other things to look in when we talk about,
The
autism
history,
and
yeah.
yeah.
Now, the question that comes to mind is, in which age should I see these symptoms or take care about my child, and know if he's having speech delay?
As soon as they notice that there's speech delay.
Some parents would say, like, we noticed at 6 months old.
Yes, so it means we have to manage at 6 months
So is it
because
possible?
we have the rule of 136 in
Hmm.
pediatric ENT. By the age of 1 month, we have to have a hearing assessment.
Hmm.
We said there's newborn, but sometimes newborn kids, like they either miss their test or the test is negative, is not responding or did not pass, so we have to repeat it. So by the age of 1 month, I have to have the diagnosis of the hearing.
Hmm.
Either the kid has normal hearing or if there is a problem.
Hmm.
By the age of 3 months, we have to have the diagnosis. Why is the kid having ear problems or not hearing? Is it because he has a nerve issue? Is he deaf? Is there fluid? Is there other issues? So we have to have a diagnosis by the age of 3 months. By the age of 6 months, we have to start the hearing rehabilitation, meaning if that the patient or the baby has hearing issues because of a nerve issue or because they're deaf or whatever, we have to start hearing aids.
Hmm.
Kids who have fluid in their middle ear, we have to address that middle ear effusion. So, but again, speech delay at 6 months usually is not detected because at 6 months the baby doesn't talk.
That's the point. That's
Yeah,
why I asked, because I think the age is very important at diagnosing
yes,
the speech
yes.
delay.
But for example, no, when I'm talking about hearing per se, by the age of 6 months, we have to have rehabilitation. But speech delay, you will not detect it before or at the age of 6 months because again they don't talk. So
Okay.
by the time that they start babbling and interacting and reacting to door, like when you close the door, when music is loud and they start dancing. So if you don't see that in them,
Yeah.
then there's a suspicion that there's
Or if they
something.
become like distracted with a noise or something. Now, the question is there any factors can help the patient having that delay in speech?
Factors that cause further speech
Yes.
delay besides the ear.
Yeah.
Again, it's developmental issues. If they have abnormal development,
Because some
psychological.
people think that, let's say, the first point, genetics may have a main role in having speech delay.
If the hearing is affected because of a genetic disease, which we have a lot of genetic diseases
Hmm.
and hereditary diseases that affect hearing, so the kid has poor hearing, then definitely you will have speech delay. But it's not the genetics that would cause the speech delay, it's the genetics that are affecting the hearing
Hmm.
that, as a consequence, the kid will develop speech delay.
Okay, one of the main discussions we have at this age is that the technology is having a great impact on having speech delay. And I think this is making a big debate within the medical professions as well, because there are some studies proves that using iPad or being isolated for a long time for for the child is also helping the child to have speech delay. Is that right or not?
It's again, I'm not a development like I'm not what they call we have the developmental medicine or the
Yeah, or
pediatric
specialists.
developmental, so I cannot comment on that, but I do see that what we call social autism.
Hmm.
So the kids who are exposed to iPads and all this technology very early on, they become isolated from their environment.
Hmm.
So definitely communication is affected at some point.
Now, after we diagnose the patient or
Mhm.
the child with a speech of delay,
Mm.
is there like any treatment options that we can interfere with?
In terms of medical treatment, obviously no. But if there is
Apart from the pharmacist, don't forget the
exactly.
pharmacist.
But again, as I said, if there is middle ear effusion, then tubes
Yeah,
that we put
that's one of
tubes.
the
And if
choices.
there is, let's say, if it's a patient who has a hereditary hearing impairment and they have, and mainly it is due to nerve issues or cochlear, like middle ear, sorry, inner ear issues,
Hmm.
then of course they could use either hearing aids or if in severe to profound hearing loss, then the answer would be cochlear implants. We do have other diseases that cause middle ear issues, for example, anomalies in the ossicles, fixation of the ossicles, or what any kind of anomalies or let's say pathologies in the middle ear, we could also address them surgically by using, prosthesis and middle ear surgery as well to help with that.
Okay, so just to conclude the main points we have discussed, it's either physiological reasons or psychological reasons. So the physiological reasons could be treated with a surgery, as you said, or there are some other interventions with a specialist. And if it's like somehow psychological, or we say
I would
uh,
say the word developmental more than
or
psychological. Yes.
development, and yeah, we refer the child to the development specialist.
Absolutely,
Yeah.
yes, yes. And usually the speech and language therapists, they also help with that as well.
That's very great, and we are also grateful to have you again today. Hopefully, and I had that wish on every end of each segment, so we will hopefully as well having you again in our
Inshallah, I
midcast.
would be happy to join
Inshallah.
again. Inshallah. Thank you.
Our dear viewers, we have reached to the end of our this segment. Hopefully, we can see you again with a new medical professional or specialist. See you again in midcast. Goodbye.